There's the transit workers. You look at the rates of sickness. I mean, they know what they're exposing themselves to, and they still do it. I mean, just God bless them.
Do you have plans to grant clemency to a large number of, or just any inmates in the state prison system to curb this corona outbreak?
We're looking at that, any way we can. We are, and we're looking at that continually. I don't think there's anything new on that right now, but it's something we're exploring all the time.
Is there any specific plans that you're considering or any specific models?
We've done a number, but nothing right now. Are there any new?
We've done about 700 parole violators statewide. Those are people who were deemed to be low risk to public safety and also high risk to COVID. And so we have done that so far, and we're continuing to evaluate it on an ongoing basis.
I think the promise was about 400 people to come out of Rikers. So far, that's been about 130 people have been released. Is there a reason for the lag?
I think we've done about 240 out of Rikers so far of the 700 statewide, but we can get you the exact number, Jesse.
And Governor, on a more kind of psychological, philosophical issue, 730 people died. These numbers keep rolling out, but it's easy, it would seem, to get numb to these sorts of stats. How do you counter that? How do you impress on people that these are human lives, that this is an enormous human catastrophe?
Jesse, if they, I hear the point. I guess one could get numb to the numbers. That's why I said, remember, every number is a human being behind that and a family. For myself, I can tell you, the last thing I do is get numb. I can tell you for the hospital staff that goes through this, they're not getting numb. For the families who are suffering, they're not getting numb. The pain is increasing. The grief is increasing. I mean, you see those pictures on TV of getting to a situation where you have to put bodies in trucks, in parking lots. I mean, how you could get numb to any of this. I can't imagine, especially New Yorkers, that we lose the humanity of this. It's something I struggle with every day. I try to think of the opposite, that, we are doing good, because you can't stop. You can't save everyone. This virus is very good at what it does, and it kills vulnerable people. That's what it does. And it does that very well. And we can't stop that. The question is, are you saving everyone you can save? And there the answer is yes, and I take some solace in that fact. Our healthcare system is operating. When I don't believe we lost a single person because we couldn't provide care. People we lost, we couldn't save despite our best efforts. But no, I don't see the numbness, and I don't believe New Yorkers see the numbness. I think the frustration of an individual situation can cause you to do irresponsible things, to go out more than you should, to disregard social distancing. I think that's an issue, and that's what I've been trying to address.
Governor, I know we're not there yet, but when people do eventually start getting back to work, will it be the reverse of the reduction, meaning they'll go back in spurts of 25% at a time, or 12 or something like that?
I don't know. It's a good question. I think they go back, is my opinion. It's not a fact. I think, and we're working on a plan with Connecticut and New Jersey, because when we go back together. I think we go back with people who have tested that they are negative, or people who have tested that they have the antibodies, which means they had the virus and they're immune from the virus. Or we go back with younger people going first, still protecting, isolating the vulnerable. But if it's waves, I think those are the waves.
You can't get reinfected?
Say it again.
Is there any proof you can't get reinfected by, if you have the antibodies? Is there
Let's
proof
ask
that-
Dr. Zucker, your friend.
So usually when you have a virus, you develop antibodies, you don't get it again. There was one report out of China where they suggested that maybe there were some cases, but that hasn't been confirmed yet.
Are you concerned that the temporary hospitals will be accepting significant numbers of patients until after the peak is passed?
A larger number of what, I'm sorry?
Are you concerned that the temporary hospitals won't be accepting significant numbers of patients until after the peak is passed?
A significant number of patients? No, they're ramping up now. The Javits Center and the Comfort you're talking about? The Javits and Comfort, well, there's two separate situations. When I say we have about 90,000 bed capacity, we brought online additional beds, right? Two ways. Number one, every hospital had to increase capacity by 50% with a goal of 100%. Every hospital has increased capacity 50%. That's why you see hospital beds